My name is Colleen Carr. I'm with the Education Development Center and serve as the Director for the National Action Alliance for Suicide Prevention. The Action Alliance is the nation's public-private partnership focused on advancing the national strategy for suicide prevention. And through that work, we work with the federal agencies, the business sector, and the nonprofit sector to really align our national suicide prevention efforts. And I'm just delighted to be part of today's event, bringing so many partners together for this important conversation around data science and risk identification. So to get started for our first panel of the day, as we were planning this National Academy series, we recognize the critical importance of grounding our discussions around data science with perspectives of individuals with lived experience. Because ultimately, all of the work we're doing, our collective work to prevent suicide, whether it's in the community, in health systems, working to build connectedness or identify suicide risk, leveraging data science, at the center of it all is our people and saving lives and building lives worth living. So I'm delighted to start today's conversation with a panel. I'm joined by 3 experts today, and we're going to have a panel focused on lived experience perspectives on risks and opportunities related to social media suicide risk identification efforts. So joining me this morning are Dr. Ursula Whiteside, based out of Washington State. We have Mr. Adam Swanson out of Oregon and Ms. Susie Reynolds-Reese out of Arkansas. And each panelist is going to introduce themselves briefly and provide some remarks from their perspective. And then we'll have some time for Q&A, including answering questions you might have today. So please do put any questions you have for our panelists in the chat as we go through this morning's session. So with that, thank you so much for joining us. And Dr. Whiteside, I'm going to turn it to you to get us started today. Thanks so much for being here.
Yes, greetings everyone. So I was invited because I am a lived experience expert. I've had my own experience of having suicidal thoughts, and I've also created a team of people with lived experience advisors to help guide treatment development research and other work. But I'm also someone who loves people who are struggling and have worked in research in clinical areas, particularly dialectical behavior therapy since 1999. And I can identify with this image here that anything is possible, that social media was and is the thing of dreams because it offers this immediate ability to potentially offer help and also to reach vast underserved populations. I would say arguably things that healthcare and research have failed to do. So with the potential to do that in a way that's innovative and compassionate is really where my experience came from. Starting out, in 2012, creating a team of people with lived experience. One of the things that we used to do was scan Twitter for people who were saying they had suicidal thoughts and try to direct them subtly to some resources. I also worked with Facebook and Instagram and worked on an overhaul of the experience that people have when they share their suicidal thoughts. And I think that it's important to say that this work starting in 2014, going through 2016, involved people with lived experience, my team of people with lived experience and others with lived experience. What I'm sharing with you right now is our lived experience advisors who created some resources around this. So in this work, I know that Facebook has been, or Meta has been doing this work for something like 15 years. And my role was really, and our role was really in the reactive work. So the posts that Facebook, that were family members or friends were concerned and didn't know what to do, were asking for help, and less in the proactive, the using machine learning to identify people at highest risk. So in my other hats, I work in the field of zero suicide, in this area of zero suicide, which is a healthcare approach that identifies and helps prevent people from falling through the cracks in distracted health systems. One of the key elements of this is transition, and I think this is super relevant from the perspective of lived experience because people are showing up online and sharing that they are struggling. And in health, whether in healthcare or otherwise, social media, we have this opportunity, and this opportunity that's often missed, this opportunity that's often lost. in my, experience over the years, this is not necessarily science-based, but here are some of the things that really rose to the top in advising my team of people with lived experience and doing qualitative interviews with healthcare patients about what they preferred their experience to be when they had thoughts of suicide, and also in interviewing people who had suicidal experiences on social media. The concerns that tend to fall out over time, and I see these repeatedly across these different areas, is the concern about shame, autonomy, about what will happen if I do something, if I post something or share something, and that's used in a way that I find not helpful, particularly where I might lose my autonomy or someone might show up my door, and that I don't think that would be helpful. People also have concern about judgment by others. I would say also in terms of hopes, the feedback that I get from people with lived experiences, like in this ideal world, they would come out from a suicidal experience and sharing that in some way, feeling understood, feeling heard and observed and seen, also feeling connected, feeling better, and sometimes finding a way to get help, whether that be clinical help, peer support help, emergency services. Some of those things are things that people have voiced as preferences and consistently come up. In terms of preferences, not surprisingly, people like to choose about how they are responded to, or at the very least, have transparency about what is going to happen and why it's happening. So if I post online, I have the option, about my suicidal thoughts, I have the option or not to receive resources, for example. Immediacy is something that's super key here. So, there is this vast spectrum of a suicidal experience. And the vast majority of it falls in the area of non-urgent. And then, there's this other part that's urgent, and that's super duper important. But parsing those two things out, I think, and thinking from those two angles is important that we consistently do that. That this immediacy, particularly in cases where somebody is at the hottest moment in their highest risk time, is incredibly important. Just for the chat experience, I noticed that in discussion sometimes around social media and flagging suicidal posts, people often are confused about what the actual procedures are, or they make assumptions that are inaccurate. So we did a review recently. I posted that in the chat that might provide some guidance around that. I would say, and to my earlier point, that all of this depends on how hot this moment is that this person is going through. And that if I am completely overwhelmed and not sure what to do and wanting to escape and thinking of suicide, my ability to take in information, and this is what people with lived experience say, is limited. And while resources that in the form of links or bullet points are valuable, they might not be what my brain can comprehend in that moment. And the feedback that I have also got is, what do I do right now? I do not know what to do. And it's almost as if we need a stop, drop, and roll to share with people who are having this experience. The similarity of being on fire physically is similar to being on fire emotionally. So in my last thoughts here is, I haven't been involved in legislation for like 7 years, but we have heard organizations like Meta, say, well, we need federal guidance around certain areas, right? I think that we have an opportunity to do some legislation that might support social media organizations to do this work, that create transparency standards, that list the number of people who were requested to be reviewed for suicidal content, or that were identified using machine learning algorithms, what they looked like, what their experience was in terms of, did they receive resources, did they have a wellness check, some of that information I think would create some relief in just understanding what they are, understanding also what actually happens when I take this step and that step, if I report a person or if I post this on social media, and also the decisions that are made, how it was decided that this is what we came up with and this is our response. And wouldn't it be great? Like, what really gets, what important things need money and they need support. And so if 1% of revenue, both from the federal government and from social media organizations, was designated to support these transitions and research, that would be super important. We, of course, need lived experience advisors, and I would say legislatively supported to do this work and financially supported. And ideally across industry, across social media industry, we would have this sort of coordination of our approach. I'll stop there.